Hi, welcome to Infusion, the podcast. I'm comedian Cris Patrick, a.k.a. self-proclaimed power man, and I'm here with my co-host and significant other, the one and only Rach. Now, today, if you listened to last week's podcast, I thought this only happens to soldiers, but it happens to a lot of people who have had some traumatic or stress in their life. We're talking about post-traumatic stress disorder, also known as PTSD. So, Rach, what can you tell the listeners about PTSD?
So Cris, you know PTSD from our combat exposure, but there's many other PTSD causes. So the most common form is sexual assault.
Sexual assault. So you're talking like, rape or incest or stuff like that, that's happened to kids, women, men, a lot of stuff like that. Is that what you're getting at?
That's exactly where I'm getting at.
Okay, and I know, like I said, I thought this only happens to soldiers, people coming back, or soldiers coming back from combat and stuff. First of all, let's hear it for the soldiers. People coming back from combat and stuff like that, who've seen their brothers fall and stuff like that, who've come back and suffered from PTSD. But what are other things about PTSD that people don't know?
So, the most common form is from sexual assault, but you probably heard it again most from the combat exposure, and that probably came from the American Sniper movie from Cris, the soldier.
Yeah, seen the movie.
Yeah. And then A Private War from Marie Colvin, the reporter.
Okay, haven't is that a documentary or?
That was a documentary.
Okay, haven't seen that one. But what the listeners don't know is that you've been on the front lines working with COVID patients through the pandemic, and you too also suffer from PTSD. But let's hear it for all the frontline workers out there at the hospitals who are dealing with COVID patients and helping us get through this.
Yeah, so mine actually comes from natural calamities. That's one of my forms.
Okay, so explain more about that.
So natural calamities can come from building fires, pandemics, and Mother Nature.
Okay, building fires, pandemics. So how do you suffer from it? How you yourself?
Because of pandemics, as you know, when we went into the Mall of America, where you were just completely confused and didn't understand.
Yeah, she told me, she's like, I'm got PTSD. I'm like, you're not a soldier. But hey, I was, and I admit it, I was dumb to the fact I didn't know. I'm like, everybody has a mask on, everybody's fine. What's your problem? You're not a soldier. What do you PT? But learning and doing research on this podcast, I learned that a lot of people do suffer from it. Like we've said, people from sexual assault and other traumatic things that have happened in your life, you can suffer from PTSD. So explain more about that and how you're going through this.
So even going through understanding it for this podcast, I understand now. You were telling me to try and explain it to you that day, and I said, I see people in hospital beds, and you're like, what are you talking about? And now I understand that is called a flashback.
Okay, you're having flashbacks of that, because like I said, and we gave a shout out to your frontline worker, and what exactly is your occupation? Tell me exactly what your occupation is.
So I'm an NST, so I work as direct care in the hospital. I love my job. I wouldn't do anything else. I work right there with the nurses and doctors.
Okay, and then how did this come about? You getting this PTSD?
So just gowning up and gowning down, going right into the patient's rooms. I have no fear still to this day of going into the patient's rooms. I love my patients. I would never not step into a patient's room. But because of gowning up and gowning down and walking into a patient's room with it, I had to come home to my family. And because there was no shots available or anything like that, I still had that fear inside of me. Will I bring this home to my family?
Okay, and then how are you dealing with? Tell them how you're dealing with working with PTSD and working with it and working through this.
So, all people with PTSD, we are not professionals. I'm just going to put that out there.
Yeah, we are not professionals. We are not licensed doctors, and we are not certified physicians. But if you do suffer from any of these symptoms that we are talking about, please, please, please seek professional help.
So that being said, for myself, I am getting counseling, and I am also starting to walk through the steps. I take Adaptive from doTERRA, that is a natural supplement from an essential oil company. There are many other forms of anxiety medicine out there. Also, I am starting to, because before the pandemic, we were able to go to concerts and be able to be out in the public without me having flashbacks or any panic attacks for me. So I am starting to get more and more out in public, just slowly getting out there. And just last week, I was able to go to the George Floyd memorial with my daughters without having any symptoms. Just slowly going back out in public, just doing some breathing techniques.
So it's typically like a baby steps type of thing. You got to slowly, more or less walk before you can run. You can't go to a concert, what is it, 20,000, 30,000 people in there. Right now, it's not the time. And unfortunately, there's not a lot of concerts going on right now. But you got to take baby steps before you can go into something big like that. Am I right?
Very much so. Very much so.
Okay. And then what are other things about PTSD that the listeners need to know?
So one of the things that we didn't talk about was it can also happen in serious accidents. If you can also it's known that you can inherit the vulnerability. So if somebody in your family has had PTSD, or more than one of your family members have had it, you are more liable to have it yourself.
Yeah, and which is interesting too, because you got a father and a brother who are soldiers. Were soldiers.
Yes.
Were they National Guard or?
National Guard.
National Guard. Yeah.
Yeah. And I don't want to claim that my brother had PTSD, but he did go through a serious thing that in the future we could probably talk about with my brother about, and he could probably go more into detail about what happened. Just going on from there, like what I was saying, you can have a close family member or more than one family member that has had PTSD. There is 7 to 8% of the global population suffers from this, and women are at a higher rate than men.
So why do you think? Why is it that women are at a higher rate than men?
Well, men would say because we're emotionally.
You're all just crazy.
Well, no, we're not. We're not crazy.
Women are just plain crazy.
No, we're not crazy. Thank you, men. But we are emotionally more. We are emotionally more. So, and this is an emotional thing.
So what are steps to is this curable? I mean, do these traumas hang with you for the rest of your life, or is this something that can be cured, or something you can get over, or something,
I never want to say the word cure.
Okay, we can't say the word cured. Is this something you can get over, or something you can,
You can work towards getting it better if you want to work towards getting it better. You could also lock yourself up and never want to deal with the problem. And which
sometimes a lot of us do.
Yes.
And I've always felt that, when you have a problem and you have something go in your life, the best thing to do is to face it. And there's also a sad thing too, is that some of these people may get on drugs or get on something that they shouldn't be on, and I'm talking prescription drugs and illegal drugs.
Yes, so we can self-medicate ourselves just to get over what we're feeling. A lot of people in this world do that.
Yeah, what I remember a few years ago, I suffered within a span of maybe like 5 years. I suffered three major deaths: my older brother, my mother, and my father, and didn't take any drugs, didn't do anything. I was trying to find a psychologist, and I wanted to find a black woman psychologist because I feel that they know a little bit more about the African American experience, and but one of the things I did, I was in the gym with my friend JR, and we were working out, and he goes, me and my sister were talking about you. Like, what do you mean? He's like, well, we were surprised that you suffered these three major deaths in your life and that you didn't take one drug, you didn't do anything. I was like, no, well, that's why I'm here, working it out in here and stuff like that. So sometimes with something like this, that we, they self-medicate and sometimes doctors overprescribe this stuff, but so there are other ways and, psychologists and people out there that you could talk to help get through this.
Yeah, and again, we reiterate that if you are suffering from this, please get help. You don't need to be locked up inside of yourself feeling these problems, and you don't need to be suffering from this when there is help.
Yeah, definitely find somebody to talk to, or and I'm sure there are people out there that could that you could probably talk to for free and stuff like that.
And another thing that is a misconception is people don't understand that you yourself could be suffering from it if somebody that you love has had natural calamity or any of these problems. You yourself could have PTSD.
Okay, yeah, so you can.
You could get PTSD. Like if you, Cris, went through something traumatic, I could get PTSD because I witnessed you.
Because you witnessed me. Okay.
So a lot of people don't understand that either.
Yeah.
But one last misconception is people can link PTSD with anger. And it's not anger. It's the person's feeling frustrated and lost and confused, and they don't know what to do, and they need a lot of love and support to get through this moment.
And when you're feeling that, and again, we can reiterate that when you are feeling that, that's a perfect time to talk to somebody or try to talk to somebody, to seek professional help, or medical help, or a psychologist, or somebody you can talk to help get you through this.
Yeah, definitely. There's steps, there's help. You don't have to get through this. There's there's so many things that a person with PTSD is going through. Just to go through some of those side effects, there's depression, fear, anxiety, isolation. They get anger because of all this, sadness.
Well, you said one of the things you said was accidents, like a car accident or something like that. I've known people who've had car accidents and were afraid to drive on a certain freeway again, or were afraid to even drive on the freeway, or some were even afraid to drive again,
Yeah. You don't know this, but I had Denzel and the girls in the car. This is before Colin and Vanessa were born, and
Colin and Vanessa's our youngest kids.
And Denzel.
Denzel's their son.
And Denzel was the oldest and way too young to be sitting in the front, but I was way too young to be having kids. I started having kids when I was 19, and for those young moms out there, I feel you. I was a young mom too. Anyways, continuing with the story. Denzel was sitting up front, and I hit a deer. And Denzel got glass in his eye. And I was terrified what was going on with my son. And I was terrified to get behind the wheel again.
So how long which was a form of, there was a trauma, which was a form of PTSD.
Yep, and my PTSD was not at the level that it is now, and I don't know if necessarily would call it PTSD at that time. It was trauma. It was
Yeah.
definitely a trauma.
Yeah.
And it didn't take me long to get behind the wheel because I was a mother. You know,
Yeah.
you do what you got to do for your family.
Yeah.
You know, and I think that's why I could go and to the George Floyd Memorial with Maxine and Zoe. You know, because Zoe really wanted to get down there and celebrate. And I could get through the crowd because Maxine was starving, and she wanted some food. And
Maxine and Zoe are our oldest daughters. And what happened was, as you all know, Eric Chauvin was found guilty. So there was a thing down by the George Floyd Memorial. And as you know, we are from Minneapolis. So there was a thing down there that they went down there. I was working, so they went down there to see this and to see what was going on. And the people down there that were, I wouldn't say celebrate, but we're happy because of the outcome, because there was finally justice in this case.
And on May 25th, me and the family are going to go march on George Floyd Day from 7 to 10. So we're excited to do that. I'll just stand back a little bit and march with my family.
And please, if any of you feel this injustice, as Reverend King said, injustice for some leads to injustice for all. May 25th, maybe with the next podcast, we'll give you guys details and all that, where to go and where this is happening at. We do urge you to stand, and if you can't make it, that's fine too. But we do urge you to go down there and stand for injustice and stand for justice for all.
And what Zoe would say is, please wear your mask.
Yeah, please wear your mask.
Yeah.
So we've talked about this, but what are some ways to, as I said before, to see light in the end of the tunnel? What are some ways to get through this and to live your life? Move on from this. And it don't get me wrong, because it is very hard to get through some trauma, and some trauma you can't get through. Some trauma you can put behind. You can put behind in the back of your mind and try and move on. But there are also ways to get through this. So what are some ways and some things you can do to get through this, to see light at the end of the tunnel?
So, yeah, some of the symptoms that we missed was hypervigilance and recurring nightmares. So to get out of this, just last thoughts on that was... I will reiterate one more time because it's just helped me so much, is counseling. In fact, I worked with 2 counselors to start getting where I am. And you don't need 2 counselors. You definitely don't. I needed
can you explain counselors as far as being a healthline worker, for our listeners, as far as the cost or anything like that?
So I started with one counselor because the work provided it, and then while I was working with her, my doctor lined up my current therapist, and now I am seeing my new therapist. So. Both of them were beautiful people to help me go.
But was that available to frontline workers too?
The first one was available because I work at the hospital, and the second one was available through my insurance.
Okay. So yeah, insurance does cover this.
Yes, absolutely. So, yeah, therapy, and then. If you can't afford therapy, find somebody to talk to. There's also free therapy out there. I don't know if anybody's aware of that. Through the community, most communities provide free therapy, so please look into that. When I was very low income, most communities do provide free therapy. So please look into that if you can't afford it.
There are resources out there for you. You are not alone.
And if you do not find that in your community, please find somebody to talk to. There is help, even if it's a good friend. And then there's natural and medical drugs out there for you, or alternative medicines out there for you. And then just starting to walk the steps like I am, and so slowly getting past where your anxieties lie.
Okay, well, you mentioned there are drugs out there for you, natural and stuff drugs. As far as the natural stuff, where are good places to go? You don't just go and say, "Oh, this is a natural drug, I'm gonna take it." Where are places to go? You can help for people that can go and get this stuff and learn more information about this. You can also, one way I know, you can Google it. There's other things too.
So I have a naturalist in Minneapolis. He's amazing. And then I also get my natural anxiety medication through doTERRA. doTERRA is an amazing company that in the future we will be talking about why they are such an amazing company. And like I said, there are anxiety medications. Now, beware, these anxiety medications can get you addicted. They are good in the short term, but in the long term, they are not good to stay on. It is always good to walk through the steps, not always rely on medication. Not saying that all medications are addictive. I am on Western medicine, and I'm on Eastern Eastern. So that's why we're doing. That's why we're moving on this, because we strongly believe that there is good health in both avenues.
And Google's a good thing too. I think if you Google natural health medicines or natural medicines for PTSD, and like she said, she works with an herbalist. An herbalist. I think what wasn't it? Present Moments.
Yep.
Present Moments in Minneapolis. If you're from the Minneapolis area, just Google Present Moments and call them up, and they're really good at giving information and talking and setting up appointments and stuff like that.
Yeah. So I think that's we're gonna wrap it up. But you guys, please, if you have any thoughts of future podcasts for us, we are willing to listen to anything. We are happy to be moving on in this podcast and future episodes in our YouTube video.
Yeah, the show will be coming up soon. Infusion, the YouTube channel, will be coming up. You can see interviews. You'll be able to see more video and interviews, and you'll be able to, some of the people that will be on the show, we'll also have on the podcast with longer interviews on the podcast. So like we said before, we are not professional doctors. We are not certified physicians. If you seek any of these symptoms or anything like that from PTSD, please seek professional help.
All right. Let's wrap it up.
Okay.
Have a great day.
Thanks for joining us for this episode of Infusion, the podcast. I'm Cris, a.k.a. Self-Proclaimed Power Man, and I'm here with my significant other, Rach.
Hey, you guys. Have a great day.
Thanks a lot for joining us. And remember, it's never too late to start feeling good.